Thank you, Dr. Zavadinov. Dr. Miller, did you have a comment?
Yeah, there is a lot of the information that Dr. Zavadinov has been talking about, I think, is highly technical and difficult for many of you who are listening in the audience. The preliminary work, particularly about iron deposition, is giving us lots of things to explore. But I think for the audience, the most important thing to understand is that when you find a finding in biology, there are many, many potential explanations. And the critical point about iron deposition, which does seem to be increased in some people with MS, is again, there's a big difference between finding an association and knowing that it has some implications in cause and effect. It's just as plausible that the iron that is there is a consequence of the disease process rather than having anything to do with either causing or making the disease process worse.
Thank you very much, Dr. Miller. We have a lot of questions from people online, so I wanted to take our next question from Johanna on Facebook, who asks, if we're able to have this procedure done as a possible cure, would we still need to stay on our drugs to help keep the disease from progressing too fast? Some research says we should, in other states we should not. And I'm wondering, maybe Dr. Miller, you could start again.
Yes, Joanna and others, as I said in my preliminary comments, there is absolutely no reason that a person who was contemplating a surgical procedure for CCSVI, and I echo what Dr. Zavadinov and Dr. Zamboni has said, that if one is contemplating that surgery, it should be only done in the context of a properly controlled trial by people who have participated with other investigators who can understand this process. But even if one goes into such a trial or has the procedure, there's absolutely no reason to discontinue the disease-modifying therapies. And I believe in Professor Zamboni's cohort of patients, they were all continuing on their treatments.
And let me add, and I think Professor Zamboni will do the same, that this thing has to maybe repeated 3 times at this press conference. There is no reason that patients stop their therapy. As Professor Miller said, clinical trials over the last 25 years clearly showed the advantages of those therapies in the most rigorous studies that have been done. Until something else is determined, we should continue in that way, and there is no reason to stop the therapies.
Yes, I agree completely with this position. Especially, I recommend to people that are under treatment with well-stabilized disease by the drug to continue and to wait for new evidences. There is some concern regarding people not responding to any treatment with very rapid decline. In this kind of people, I understand that the publication of our paper generate a desperate need to try this kind of treatment. And it is very important that her or his neurologist aware of the patient not responding to treatment may directly offer angioplasty in this particular kind of people under compassionate ground. Otherwise, the danger is that people come outside where business is organized for performing angioplasty with techniques that are not controlled, without any ethical issue, any IRB, any ethical protection